presentation. Can you see my slides? Okay. Let's just get in this order. The Team 1, Physiology of Respiratory System presentation. And I hope we can have more interaction between our teammates. So after the first team's presentation, each team can have a simple feedback to the presentation. And what you can say, what you can feedback in the presentation, you can ask a question about the presentation you have encountered the problem, or you can tell them their slides is beautiful, or you can tell, hey, what is the point you learned today, all right? And can each team put your slides in the line group? Each team, please put your slides to the line group. And if you're ready, team 1 can start right now.
Wei and Xiaohan, are you ready? If you're not, if you need some more time, maybe Denyu and group 2 can start first. Okay. So
Okay. If you are
group 2
ready, you can
first.
start right now.
Selena, are you okay? Yes. 大声啊。I don't hear your voice.
Yes.
Are you speaking?
We can see your PowerPoint and hear your voice. You can start now.
I don't hear your voice. Are you
Is
okay?
Xiaohan speaking right now?
No.
We didn't hear you seconds ago.
Hello.
Okay, we can hear you now.
Okay.
Okay.
Okay. And my part will introduce the physiology of respiratory system. And first, the respiratory system consists of the respiratory tract and lungs. The respiratory tract includes the nose, pharynx, larynx, trachea, and bronchi. And the nose, pharynx, larynx are the upper respiratory tract, and the trachea and bronchi at O level are the lower respiratory tract. And the respiratory system have 5 functions, and one is oxygen supplier. The job of the respiratory system is to keep the body constantly supplied with oxygen. And elimination is elimination of carbon dioxide. And third is gas exchange. The respiratory system organ oversee the gas exchange that occur between the blood and the external environment. And four is passageway. It allows the air to reach the lungs. And five is humidifier. It purify, humidify, and warm the incoming air. And This is protect the lungs from irritant. The nose will filter the air during inhalation to prevent a large particle from entering the lungs, and mucus line the bronchi. Irritant that make it past the nose get stuck in the mucus, which is moved the upward toward the source by small hair called cilia. And mucus and other irritant can also be expelled through the claws, and claws move the mucus more quickly than the cilia. And next is respiration. Pulmonary ventilation. Air must move into and out of the lungs so that gases in the air sacs are continuously refreshed, and this process is commonly called breathing. And external respiration. Gas exchange between the pulmonary blood and alveoli, and respiratory gas transport. Oxygen and carbon dioxide must travel through the bloodstream to the lungs and tissue cells of the body. And internal respiration, gas exchange is necessary between capillaries, blood, and tissue cells through the body. And next is Yu Wei. It's your turn.
Okay, and the following is first lung cancer. No, yes, this page. And first lung cancer automatic is in the early stage. The pain and comfort we can feel is a physical response triggered by nerve in our body. But we don't have this terminal nerve in our lungs, so they can grow quietly and even be misdiagnosed as general pneumonia, cold, or allergy. More than 40% of lung cancer patients are diagnosed after the disease continues to deteriorate, and one-third of them are already in the third stage of lung cancer when they are discovered. Next page. And the following is a list of lung cancer procedures that may appear in lung cancer patients. First, chronic cough. Everyone will cough, but if you continue to cough after taking medicine, or your cough and hoarseness persist for more than 3 weeks, then you may must to see a doctor again and take a lung X-ray. Second, shortness of breath. If you experience frequently shortness of breath, it could also be a symptom of lung cancer because the tumor blocks the airway and the fluid around the lung cancer increases, squeezing the lungs so that breathing is not smooth. It's perfectly normal to be out of breath occasionally, but it is important to seek help from your doctor if you short of breath after climbing stairs, lifting clothes, or doing normal activity that used to be easy. Third, chest pain. While tumors are growing in the center of the lung don't cause pain. The central lung cancer may develop on the edge of the lungs or in chest wall can cause discomfort. Lung cancer causes chest pain. It may be due to enlarged lymph nodes or cancer cell that has spread to Chadwell, Lima, or wrist. So when you cough, laugh, or have voicing chest pain, you should take a deep or when you take a deep breath, you should really seriously consider registering with a cardiac department. Next page. And the bone is can hear self-breathing. The whistle sound while the lungs are constricted, or inflamed. Unexplained weight loss. Lung cancer patients often lose weight rapidly in a short period of time because the cancer cells are consuming all the energy and the nutrients. Next page. And the bone pain. Advanced lung cancer may metastasize to bone marrow, causing bone pain. Most bone cancer patients are elderly, and the bone pain caused by lung cancer is usually concentrated in the back, shoulder, arms, or neck. Finally is voice change. Lung cancer tumor can affect the vocal cords, which can change the voice. And yes, and our presentation is ended. Any question or some feedback?
Okay, thanks to the Team 1's presentation of physiology. And here's my comment. And respiration is one of the important vital signs in nursing because the word routine, the first thing to do in word routine is to get the vital sign of each patient, and respiration is one of the most important data. And when we are counting their respiration, we not only have to count how fast they breathe per minute, but we also have to look at how deep they breathe and look at the characteristic of their respiration. For example, if the patient have problem like edema, they may have a different breathing characteristic. So yeah, this is truly an important part. And when it comes to AI, how can AI help us? That is the next question we're gonna getting on. Okay, so thank you for the Team 1. Does Team 3 have any feedback? If there's no more feedback, then we will go on to Team 2, all right?
Yes.
Okay, can you see my slides?
Yes.
Yes.
Okay. Okay, and next, after we talk about how respiratory system works, then we're going to discuss what's wrong will go with the respiratory system. And the topic today we're going to discuss is lung cancer. Okay. Before talking about lung cancer, we have to know what is a cancer. First, we have to know what is a tumor. A tumor is that in your organ, and there's some kind of cells that grow abnormally, and it grows faster than your normal cells. So because it grows faster than your normal cell, abnormal cells will replace your normal cell, and it becomes bigger and bigger. Then it's a tumor. And there's two types of tumor. Tumor is not necessarily harmful to your body. So a benign tumor is that not harmful to your body, but it just grow there. So somebody may do a surgery to take it off or just put it there because it doesn't harmful to your body. But if it's a malignant tumor, then it's gonna hurt your body. It can make you uncomfortable or even get to other part of your organ, and it may kill you in the end. So a malignant tumor, we call it as a cancer, and cancer is a disease name, and tumor is the abnormal cells, the body of the abnormal cell, we call it tumor, and it becomes a disease, we call it cancer. So a lung cancer is that your lung grows a tumor, then this is lung cancer. Okay, so here is the epidemiology of the lung cancer. The first thing to know is most of the lung cancer is highly related to smoking. You can see the chart. 80% of patients of lung cancers do smoke. Only 20% of them don't smoke. So you can see lung cancer is highly related to, smoking is highly related to lung cancer. And the other factor that might cause lung cancer is like your working environment. There is many chemicals or radiation surrounding your working environment, and they will also cause lung cancer. And the other things to know is there's more men get the lung cancer than women. And the reason due to this is that men smoke more than women. Okay, so and here's some syndrome that you might see in the clinic. And primary tumor is that when you get lung cancer, the tumor only grows in your lungs. It doesn't go to the other part of your body. And because it only affects your lungs, so you will see only some breathing symptoms. For example, your chest will feel discomfortable, or you will cough. And dyspnea is that you feel hard to breathe in. And hemolysis is when you cough out with some blood, and there's hemolysis. And you can see the percentage behind the syndrome, and that means how many people will have this syndrome when they get primary tumor of lung cancer. And the second level of lung cancer is that intravascular spread. That means the tumor get to the other part of your chest, for example, your heart or other place. And it will start to have other syndrome that is more significant than the primary tumor. And the third level of lung cancer is extrathoracic spread. That means the tumor cells go around your body by your lymph or by your blood, and it may go to your bone or go to maybe your gut, your brain, whatever. Then you will have different kinds of severe syndrome. And to diagnose if you have lung cancer, there is two major ways to diagnose the lung cancer. The first kind and the the more kind we use is the imaging test. And it's simple, it means you diagnose by pictures, imagine, like X-ray. X-ray is the easiest way that we most use. You can see the arrow here. Here is some different part with the other side, and that is a tumor. Or you can see the CT scan, the white here. And there's also other kinds of imaging tests, for example, MRI or this endobronchial ultrasound. Do you know ultrasound? Ultrasound. When you're pregnant, you may go to the clinic and the doctor will do ultrasound to your baby and you will see the baby moving. That is ultrasound. And endobronchial ultrasound is you do ultrasound in your bronchial, right? And the other part is tissue test. Tissue test is to test if you have lung cancer by getting your cells. For example, the sputum cytology is. Do you know sputum? When you cough and you spit out some yellow thing in your lung, then that is sputum, and they will get the sputum to test if there is any tumor cells in the sputum. That is sputum cytology. And the transthoracic needle aspiration is to stuck a needle into your chest, and they will get some cells from your inside of your chest, and they use those cells to test if you have a lung cancer. And this is the two different kinds of ways to diagnose a lung cancer. Okay.
Then there are two main types of lung cancer, and the first one is non-small cell lung cancer. You can call it NSCLC. About 80 to 85% of lung cancers are NSCLC, and the main subtypes of NSCLC are adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. These subtypes, which start from different types of lung cancers, are grouped together. The lung cells are grouped together as NSCLC because their treatment and prognosis outlook are often similar. Okay, and the first one is adenocarcinoma. Adenocarcinomas start in the cells that would normally secrete substance such as mucus. This type of lung cancer occurs mainly in people who smoke or used to smoke, but it is also the most common type of lung cancer seen in people who don't smoke. It is the most common type of lung cancer. They are more common in women than in men, and it is more likely to occur in younger people than other types of lung cancer. It is usually found in the outer parts of the lung, and it is more likely to be found before it has spread out. And people with a type of adenocarcinoma called adenocarcinoma in situ, called bronchiolobular carcinoma, tend to have a better outlook than those with other types of lung cancer. The second type is squamous cell carcinoma. It starts in the cells, which are flat cells that line the inside of the airways in the lungs. They are often linked to a history of smoking and tend to be found in the central part of the lungs, near a main airway, which is the bronchus. And the third one is large cell carcinoma. Large cell carcinoma can appear in any part of the lung. It tends to grow and spread quickly, which can make it harder to treat. And a subtype of large cell carcinoma, known as large cell neuroendocrine carcinoma, is a fast-growing cancer that is very similar to small cell lung cancer. Okay, the next page. And the second big type of lung cancer is small cell lung cancer, SCLC. It is about 10% to 15% of all lung cancers are all this type, and it is sometimes called old cell cancer. This type of lung cancer tends to grow and spread faster than NSCLC. In most people with SCLC, the cancer has already spread beyond the lungs at the time it is diagnosed. Since this cancer grows quickly, it tends to respond well to the radiation therapy. Unfortunately, most people of having the cancer will return at some point. And the other types of lung tumors, along with the main types of lung cancer, other tumors can occur in the lungs too. The first one is lung carcinoid tumors. It accounts for fewer than 5% of lung tumors. Most of these grow slowly. For more information about these tumors, you can see you can just look for it in some maybe some websites, but not here. And the number two is other lung tumors. The other types of lung cancer, such as adenoid cystic carcinomas, as well as benign lung tumors, such as hematomas, are rare, and these are treated differently from the more common lung cancers and are not discussed here too. Number three is cancers that spread to the lungs. It starts in other organs such as breast, pancreas, kidney, or skin. Can sometimes spread to the lungs, but these are not lung cancers. For example, cancer that starts in the breast and spreads to the lungs is still breast cancer, not lung cancer. So treatment for these type of cancer to the lung is based on where it started. Okay, next page. Most lung cancers do not cause any symptoms until they have spread, but some people with early lung cancer do have symptoms. If you go to your doctor when you first notice that you can maybe got lung cancer, the earlier stage you found, the treatment is more likely to be effective. Most of these symptoms are more likely to be caused by something other than lung cancer. So if you have any of these problems, it is important to see your doctor right away to the so the cause can be found and treated if needed. The most common symptoms of lung cancer are, and you can see, a cough that does not go away or gets worse, and coughing up blood or rust-colored sputum, and chest pain that is often worse too, with deep breathing, coughing or laughing, and hoarseness or loss of appetite, maybe weight loss or shortness of breath, feeling tired or weak, infections such as bronchitis that don't go away or keep coming back. If lung cancer spreads to other parts of the body, it may cause bone pain or nervous system changes. You can have problems like dizziness, balance problems, or just headache. From cancer spread to the brain, you can have these kind of symptoms. And yellowing of the skin and eyes if the cancer spread to the liver. Okay, swelling of lymph nodes, collection of immune system cells, such as those in the neck or above the collarbone. Some lung cancers can cause syndromes, which are groups of specific symptoms. Next page, please. Like number 1 is Horner syndrome. Cancers of the upper part of the lungs are sometimes called Pancoast tumors. These tumors are more likely to be non-small cell lung cancer, NSCLC, than small cell lung cancer, SCLC. Pancoast tumors can affect certain nerves to the eye and part of the face, causing a group of symptoms called Horner syndrome. Maybe you can get dropping or weakness of one upper eyelid or a smaller, like a dark part in the center of the eye in the same eye, or little or no sweating on the same side of the face. Then this syndrome can also sometimes cause severe shoulder pain too. Number 2 is superior vena cava syndrome. This is a large vein that carries blood from the head and arms down to the heart. It passes next to the upper part of the right lung and the lymph nodes inside the chest. Tumors in this area can press on the SBC, which can cause the blood to back up in the veins. This can lead to swelling in the face, neck, arms, and upper chest, sometimes with a bluish red skin color. It can also cause headaches, dizziness, and a change in consciousness if it affects the brain. Sometimes will be life-threatening if it not be treated right away. Number 3 is paraneoplastic syndromes. Some lung cancers make hormone-like substances that enter the bloodstream and cause problems with distant tissues and organs. Even though the cancer has not spread to those places, these problems are also called paraneoplastic syndromes. Sometimes these syndromes may be the first symptoms of lung cancer because the symptoms affect other organs. A disease other than lung cancer may first be suspected as causing them. It can happen with any lung cancer, but are more often associated with SCLC. And there are some common syndromes included SIADH. In this condition, the cancer cells make ADH, a hormone that causes the kidneys to hold water. This lowers salt levels in the blood. Symptoms of SIADH can include fatigue, loss of appetite, muscle weakness or cramps, vomiting, restlessness, and confusion. Without treatment, severe cases may lead to seizures and coma. Number 2 is Cushing syndrome. In this condition, the cancer cells make ACTH, a hormone like that will cause the adrenal glands to make cortisol. This can lead to symptoms such as weight gain, easy bruising, weakness, drowsiness, and fluid retention. Cushing syndrome can also cause high blood pressure, high blood sugar levels, or even diabetes. Number 3 is nervous system problems. SCLC can sometimes cause the body immune system to attack parts of the nervous system, which can lead to problems. One example is the muscle disorder called Lambert-Eaton syndrome. In this syndrome, muscles around the hips will become weak. One of the first signs of may be terrible getting up from the sitting position. Later, muscles around the shoulder may become weak. A less common problem is the paraneoplastic cerebellar degeneration, which can cause loss of balance and unsteadiness in the arm and leg movement, as well as trouble speaking or swallowing. SCLC can also cause other nervous system problems, such as muscle weakness, sensation change, and vision problems, or even change in behavior. High levels of calcium in the blood, which can cause frequent urination, thirst, and vomiting, belly pain, weakness, fatigue, dizziness, and confusion. This is number 4. And number 5 is blood clots, like blood that gather together, not fluid, is blood clots. Okay.
Oh, and here is our reference. Okay, so this is our introduce of pathology of lung cancer. Can you guys give us some feedback?
Hello, Deng Yu.
Hi.
I think my parts are some your PPT one slice are same with me. I think is it okay?
Yeah, that's okay, because there is a lot high related to physiology and pathology, because pathology is the abnormal version of physiology, so they are very highly related, so it's okay.
Oh, okay. And the finally, and in the semester finally, our PPT are mixed together, or to put one person to collect them.
Again.
Our PPT are in the list are collect or or one people to take the PPT, because I think
you mean well, we collect all the PPT together and put it in somewhere like cloud?
yes, because
okay. I will do this.
Oh, okay.
Okay. That's okay. I will open a OneDrive cloud and I will put it on later. Okay. Don't worry.
Okay.
Okay. Does Team 3 have any feedback?
No, you are great.
Okay, thank you. So let's get straight to Team 3, all right?
Thank you for the wonderful presentation. I understand that were about the sign and symptom tumors of lung cancer. Also, there were pictures in slides, so it was easy to understand. Thank you.
Thank you.
Thank you.
Can I hear my voice?
Yes.
Thank you for your wonderful presentation. I learned a lot about lung cancer. I'm sorry we haven't made the slide yet. I'd like to investigate further in group 3 from now. And if possible, could I make an announcement at the beginning of next week's meeting? Sorry.
Can you repeat again? I didn't listen clearly. Sorry.
Oh, sorry, we haven't made the slide yet. If possible, could we make an presentation at the beginning of next weekend's meeting?
Of course, of course.
Thank you.
Okay, so
Thank you.
that's okay. Then, so we have give me a second. Okay, can you guys see my slides?
Yes.
Okay, then we have partially finished introducing the lung cancer, and this is the third time of our meeting, and we're going to have 5 times of meeting. So we are still have 2 times of meeting, and we're going to do next is we have to think of what can we do, how can we apply AI to lung cancer. And I have go to the bio exhibition last week, and here is 2 of the 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 company I see in the exhibition. The first is I will put it on in a group later. This is the application of image recognition in pancreas cancer, because you know the pancreas cancer is called cancer king because it's very hard to diagnose in the early period. So this AI system helps doctors to recognize the early period of the pancreas cancer. And this is the other application of AI, and this is the application to diagnose the chest screening of lung cancer. Yeah, and I will put these 2 slides, these slides to the group later. And here's the link. You can go to the website, and there's all English version, so don't worry about it. And so we have already introduced what is AI and how AI works, and we have introduced what is respiratory system and how lung cancer goes and what's going on. So the next meeting, I hope we can team up again, and each group can make can give us some opinion of the the apply to respiratory system to the lung cancer. You can introduce how AI can help us to diagnose the lung cancer, or how can it help us to do the treatment to the lung cancer. And you also have to make the slides next meeting, and you can not only refer this website, you can go find some other, for example, journal or some news by yourself. And don't forget to put your reference in the end of the slide, because we are professional teams. So where the information comes from is very important. We have to get some reliable information. All right. Okay. So we have to decide the next time of our meeting. And here is the schedule of our teammates. The red number means there's somebody unavailable late date. So as you can see, most of the date in August are unavailable. There's only 3 days that everybody is free. But we still have two types of meetings. So I have to ask you guys, if you like to get 2 meetings in 3 days, that means you're gonna meet 2 times in 3 days, or we're going to get a longer span, for example, in different week, but maybe there is 1 or 2 person will miss the meeting. But don't worry, if we choose the option 2, we will have the recording. So I will send the link to the YouTube link to you, and you can review our meeting. And so you won't lose any information in the meeting. You just didn't participate. So don't worry about it. So is it clear? Do you have any questions?
No.
Okay, so let me repeat again. The next week we are going to do is first students from Okayama is going to introduce us the treatment and medication of lung cancer, right? And the second things, each team, we have 3 teams right now, right? We can think about how can we apply AI to lung cancer. And don't forget to make a slides to help to introduce your opinion, your idea, all right? And you have to put your reference in the end of the presentation. Okay, and the application are not necessarily narrowed in physiology or physiology. You can think whatever you have come up with and any idea, all right? And the next thing is I will open up the vote later to let you guys pick which option we're going to choose, and to do our fourth and fifth types of meeting. Is that clear? And I have already sent the slides to the group, so you can download it and you won't forget what to do next week. Do you guys have any questions?
Yeah.
Or if you are confused of anything we're going to do, you can ask me privately by line or mail. All right?
Okay.
Okay. So if there is no questions, then our meeting will be end now. All right? Goodbye.
Goodbye, everyone.
Bye.
Goodbye.
Bye.